Hello everyone, this is William Tapscott. I'm here with Taylorsville Crime Watch. Today I'm here with Beth Morris, the lead of the prevention team for ASAP. Beth, what does ASAP stand for?
ASAP stands for the Alliance for Substance Abuse Progress in Bartholomew County. And it's a 2-year initiative that started just about a year ago, April 2017, and will run through April of 2019. And the intent of the initiative or the alliance is to activate the entire county to fight the opioid epidemic that we are experiencing with too many overdoses and too many deaths.
Beth is here to discuss the epidemic in our community.
So we know that 30 people died from overdoses last year compared to 12 in 2016 and 6 in 2015. So you can see it's gone from 6 to 12 to 30. It's increased dramatically, and even one death from overdose is too many. So ASAP has organized in a way to try to get in front of this crisis. So there are 4 different groups that are working under the ASAP banner. I'm in charge of the prevention group, and we can talk about that in a bit. There's also an intervention team headed by Judge Kelly Benjamin, and that team works with law enforcement, police department, sheriff's department, the court system, the jails. And then there's the treatment team, which is looking to fill gaps in treatment so that people who have addiction and want help will have a local place to receive help. And then the 4th team is the recovery team under Scott Hunley that is looking to expand all of the recovery options that could be available. Ben Jackson is also working on housing so that people have a place to go after they get out of treatment or after they get out of jail. So there are a number of aspects that we want in place to help with recovery so people can sustain their recovery from drugs.
That is awesome. We had a couple questions sent in. Emily and Shirley, they'd like to know, how does a person become addicted to opiates?
Unfortunately, it's all too easy. What happens is that everybody's brain has opioid receptors in the brain and the spinal column. And those receptors are configured exactly so that opiates will adhere to the receptor and not only cut pain, but they also can produce euphoria. And so if somebody is on opiates for very long, the chance of becoming addicted goes up, because what happens is the same level of drug that once was easing the pain no longer works. People develop a tolerance, so they up how much they're taking, they take more than is prescribed, or they take somebody else's prescription and develop that tolerance, and over time the tolerance can lead to addiction. So the longer somebody's on pain pills, the more likely they'll become addicted. And sometimes when someone's addicted and they can't get a prescription for pain pills anymore, then they turn to the illegal sources like heroin or fentanyl.
Cecil and Liz, why has the epidemic gotten so much worse?
It's gotten worse because in the 1990s, the drug companies who were reformulating opioids to be long-lasting and extended release convinced the physician community that these new formulations were not addictive. And they basically told physicians that as long as somebody was in pain, they wouldn't become addicted because the pills would only deal with the pain. They would no longer produce that euphoria that other earlier versions of opioids did. And the physicians believed what they were told, and the physicians also had a lot of pressure from us as patients and from regulatory agencies who said, you've got to treat our pain. You can't let us suffer. And so physicians were being told they needed to aggressively treat pain. Those of us as patients were saying, yeah, we don't want to be in pain. Do something for me. The drug companies were saying, oh, these new pills are not addictive. And so it was a perfect storm. And addiction increased rapidly over those years until somebody finally figured out that people they are in fact becoming addicted, and are dying in large numbers. So then the medical community started cutting back on who could get the pills. Some of you may remember hearing about pill mills years ago. People would drive to Florida in order to see a doctor who would prescribe whatever you wanted as long as you paid in cash. They were all over the country, but there were certain places where they were more prevalent. That was all part of the same time period when people were getting more and more addicted. But once the medical community had to crack down on available pain prescriptions, that's when heroin reemerged and became very much easier to get and much cheaper to get. And so many people who already had established an addiction turned to those illegal drugs.
Tom, Daryl, and Toby wrote in, how does Narcan work against a overdose?
So Narcan is the brand name for the chemical naloxone, and the way that Narcan works is that remember I talked about those opioid receptors, and the opioid fits right into that receptor. When someone is given Narcan after an overdose, the Narcan knocks that opioid molecule off the receptor, and so it undoes the overdose. The problem is that sometimes the Narcan doesn't last as long as the opioids do. So somebody might need another dose because then the Narcan disappears from somebody's system and those opioids are still floating around and they reattach. So that's why sometimes people need more than one dose. But it's an important drug to have available. If you have a family member who has an opioid addiction, it's really important to have a prescription on hand just in case. And you can get one at any Indiana pharmacy without a prescription. They'll want to teach you how to use it, and you should still call 911 because somebody can still get in trouble after they've had Narcan. But we do recommend that families have it on
Donna
hand.
and a mother wrote in, what are the recovery options for pain pills?
So when someone has developed an addiction, it's important to understand that recovery is possible. Treatment is possible, recovery is possible. It's not easy, it's a tough drug to overcome, but it is important to get help. So there are treatment programs, some are outpatient, some are inpatient, and again, ASAP is trying really hard to fill the gaps so that there are more choices. But the treatment that ASAP believes is the most effective based on research studies is called medication-assisted treatment. And medication-assisted treatment provides a very low-dose opioid in order to counteract the dope sickness that people get during detox. So it's very unpleasant to just go off opioids, which is why people keep seeking the drug instead of getting themselves clean. But with medication-assisted treatment, it's a very low dose that keeps that sickness away and allows the person to do the other work that they really need in terms of dealing with emotions, dealing with accountability, being able to take care of their family, being able to hold down a job. It frees up the person's well-being so that they can do all of those helpful things and aren't spending all of their energy and time looking for their next fix. So we really recommend medication-assisted treatment, which combines the medication with counseling and with behavioral therapy.
If someone had questions or they wanted to contact either you or the ASAP administration, how would they do that?
The best way is probably through the ASAP website, which is asapbc.org. And there's a contact form on that website, and somebody will respond to you pretty quickly. There's also a Facebook page for ASAP, and we respond to messages we get on that as well, and also a Twitter account. But probably the Facebook page or the website are the best ways to get in touch with us.
Is there any special events coming up for ASAP?
Yes, I'm so glad you asked that, William. Next Wednesday, April 11th, and if you're watching this after April 11th, I apologize, but on April 11th, we have two speakers coming to town who are a father and son. They're called David and Nick Sheff, S-H-E-F-F. Everybody thinks we're talking about cooks when we talk about the chefs, but they have a really powerful story about Nick's addiction. So Nick is the son, and he and his father are both writers. They're both authors, and they've both written books about their journey. So Nick wrote a book about what it was like to go through addiction and out the other side through recovery. And David, as the father, wrote a very touching book about what a helpless feeling it was for him as a father, and what he tried to do to help, and what worked and what didn't work. So we think that's going to be a really useful presentation for folks. So there are 2 sessions. One is at IUPUC at 11:30 on Wednesday the 11th. The other is 6:30 in the evening at the North High School cafeteria. And we really hope that parents and their young people will come to the evening one, because we think it's going to be really useful to have parents or caregivers with their students attend together. So we are asking people to go to Eventbrite, eventbrite.com. Free tickets are available to either of those sessions. The sessions are going to be very similar. There's no reason to come to both of them, but we do ask that you get a ticket in advance so that we can manage the demand for seats. The second event that I'd like everybody to know about is the 1-year report to the community for ASAP. As I said, we've been about this for about a year. We really want to let the community know the progress that we've made and what we're working on now, what we hope to accomplish in that second year. So April 25th, that's also a Wednesday, at the Commons at 6:30 in the evening, we will be making a report to the community, and the public is welcome to attend. We hope to have a full house. We'll have the Indiana drug czar, Jim McClellan, will be there, talking about how the state is approaching this crisis and how the state thinks we're doing and how they can help. And then Dr. Jennifer Walthall, who's in charge of the Family and Social Services Administration for the state, will be there as well. So we think it'll be well worth everyone's time to find out what's happening.
All right. Thanks for your time and your interview.
Thank you.